Question 1. A social worker is conducting an initial assessment with a 32-year-old client who reports feeling hopeless and states, "Sometimes I think everyone would be better off without me." The client denies having a specific plan or intent to harm themselves but admits to passive suicidal ideation and frequent thoughts of death. What is the most appropriate next step for the social worker? A. Schedule a follow-up session to explore these feelings in more depth. B. Develop a safety plan with the client and assess for protective factors. C. Immediately refer the client for an involuntary psychiatric hospitalization. D. Contact the client's emergency contact to inform them of the client's statements. Answer: B. Develop a safety plan with the client and assess for protective factors. The concept tested here is risk assessment and crisis intervention for suicidal ideation. The keywords hopeless and thoughts of death indicate suicidal ideation, but the client denies having a specific plan or intent, meaning there isn't an immediate, imminent risk requiring involuntary hospitalization. The most appropriate next step is to address the ideation directly by collaborating with the client to create a safety plan, which empowers them while providing concrete steps for managing distress, and to assess for protective factors that can buffer against risk. For example, a safety plan might include identifying coping strategies, contacting supportive friends, or calling a crisis line if thoughts intensify. The key is to assess and intervene collaboratively at the client's current level of risk. Question 2. A social worker is facilitating a group therapy session when one member begins to aggressively challenge another member's statements, using accusatory language and raising their voice. The social worker observes the second member visibly recoiling and becoming distressed. What is the best action for the social worker to take in this moment? A. Allow the interaction to continue, as conflict can be a valuable part of group dynamics. B. Remind the aggressive member of the group rules regarding respectful communication. C. Terminate the group session immediately to prevent further escalation. D. Focus on the distressed member, asking them how the interaction is impacting them. Answer: B. Remind the aggressive member of the group rules regarding respectful communication. This question tests the social worker's ability to manage group dynamics and maintain a safe therapeutic environment. The keywords aggressively challenge, accusatory language, and distressed indicate that the group boundaries are being violated and a member is being harmed. The best action is to intervene directly and assertively to enforce established group norms and protect the vulnerable member, without shaming the aggressive member. For example, the social worker might say, "Let's remember our group agreement to speak respectfully and allow everyone to share without interruption." This intervention models appropriate behavior and reestablishes safety for all participants. Question 3. A social worker receives a subpoena requesting a client's entire clinical record for a civil legal proceeding. The client, who is still actively engaged in therapy, has not provided consent for the release of information. What is the first action the social worker should take? A. Immediately release the requested records to avoid legal penalties. B. Contact the client to discuss the subpoena and obtain their informed consent. C. Seek legal counsel regarding the validity of the subpoena. D. Assert privilege and decline to release any information without a court order. Answer: B. Contact the client to discuss the subpoena and obtain their informed consent. The concept here is client confidentiality and responding to subpoenas. The keywords subpoena requesting, entire clinical record, and client has not provided consent indicate a conflict between legal demand and ethical obligation. The first and most crucial step is to involve the client, as their right to confidentiality is paramount, and they have a right to know about and consent to or object to the release of their information. For example, the social worker would explain what the subpoena means, what information is being requested, and the potential implications of releasing or withholding the records. Remember, client involvement is always the priority unless there's an immediate safety risk or explicit waiver of privilege by law. Question 4. A 68-year-old client with early-stage Alzheimer's disease, living independently, informs their social worker that they recently drove their car into a ditch but were unharmed. The client insists they are still a safe driver. What is the most ethical course of action for the social worker? A. Respect the client's autonomy and do not intervene, as they are still living independently. B. Immediately report the client to the Department of Motor Vehicles for unsafe driving. C. Discuss the incident with the client, explore their understanding of the risks, and encourage them to consider alternative transportation. D. Contact the client's family members to inform them of the incident and request their intervention. Answer: C. Discuss the incident with the client, explore their understanding of the risks, and encourage them to consider alternative transportation. This question tests the social worker's ethical balancing act between client autonomy, safety, and beneficence, particularly with clients experiencing cognitive decline. The keywords early-stage Alzheimer's disease and drove into a ditch but were unharmed indicate a potential safety risk coupled with impaired judgment, yet the client maintains they are a safe driver. The most ethical first step is to engage the client in a conversation about the incident, validate their feelings, gently explore the risks, and empower them to consider safer options, upholding their dignity while addressing the safety concern. For instance, the social worker might say, "I'm glad you're safe. Let's talk about what happened and how we can ensure you stay safe on the road, perhaps by looking at other ways to get around." The goal is collaboration before external intervention. Question 5. A social worker is working with a client who consistently blames their past traumas for their current struggles, refusing to acknowledge any personal responsibility or agency in their recovery process. The client frequently states, "It's not my fault, it's because of what happened to me." What defense mechanism is the client primarily demonstrating? A. Sublimation. B. Rationalization. C. Intellectualization. D. Projection. Answer: B. Rationalization. This question assesses the understanding of common defense mechanisms. The keywords consistently blames their past traumas, refusing to acknowledge any personal responsibility, and "it's not my fault, it's because of what happened to me" are classic indicators of rationalization. Rationalization is a defense mechanism where individuals create logical, seemingly reasonable explanations for their unacceptable thoughts, feelings, or behaviors to avoid the true, often uncomfortable, reasons. For example, a student might say they failed an exam because the teacher was unfair, rather than admitting they didn't study enough. It's about finding an acceptable excuse to protect one's self-esteem. Question 6. A social worker is developing a treatment plan for a 25-year-old client diagnosed with major depressive disorder who has recently started a new antidepressant medication. The client reports feeling a little better but is still struggling with motivation and anhedonia, inability to feel pleasure. What is the best initial focus for the social worker in therapy? A. Encourage the client to increase their medication dosage for faster improvement. B. Explore the client's childhood experiences to uncover the root causes of their depression. C. Facilitate behavioral activation activities to increase engagement and feelings of accomplishment. D. Refer the client for electroconvulsive therapy, ECT, due to persistent symptoms. Answer: C. Facilitate behavioral activation activities to increase engagement and feelings of accomplishment. This question tests knowledge of evidence-based interventions for depression, particularly when medication is starting to take effect but behavioral symptoms persist. The keywords "a little better but still struggling with motivation" and anhedonia indicate a need for active, structured intervention. Behavioral activation, which involves helping clients schedule and engage in positive, rewarding activities, is highly effective for improving mood, increasing motivation, and combating anhedonia in depression. For example, the social worker might help the client identify simple, achievable activities like going for a short walk, listening to music, or connecting with a friend, and then schedule them into their week. This approach focuses on concrete actions to improve daily functioning and mood. Question 7. A new client, a 45-year-old immigrant, presents to therapy expressing deep mistrust of authority figures, including mental health professionals, due to past negative experiences in their home country. They appear guarded and reluctant to share personal information. What is the most important immediate goal for the social worker? A. Directly confront the client's mistrust to challenge their perceptions. B. Educate the client about the social worker's ethical obligations and confidentiality policies. C. Focus on building rapport and establishing a trusting therapeutic relationship. D. Refer the client to a different social worker who shares their cultural background. Answer: C. Focus on building rapport and establishing a trusting therapeutic relationship. This question centers on the critical initial phase of therapy, particularly with clients who have a history of mistrust. The keywords deep mistrust of authority figures, guarded, and reluctant to share personal information highlight the primary barrier to effective treatment. Before any specific interventions can be successful, the most important immediate goal is to establish rapport and a strong, trusting therapeutic relationship, which is the foundation of all effective social work practice. For example, the social worker might focus on active listening, empathy, validating the client's past experiences, and demonstrating consistency and reliability in their interactions to slowly build that trust. Without trust, meaningful progress is unlikely. Question 8. A social worker is providing grief counseling to a client whose spouse recently passed away. The client expresses intense guilt, believing they are responsible for their spouse's death due to a minor argument they had days before the passing. This guilt is consuming the client and preventing them from processing other emotions. What is the best therapeutic response from the social worker? A. Reassure the client that they are not responsible for their spouse's death. B. Explore the client's relationship with their spouse to understand the source of their guilt. C. Challenge the client's irrational thoughts directly using cognitive restructuring techniques. D. Validate the client's feelings of guilt and normalize the experience of survivor's guilt in bereavement. Answer: D. Validate the client's feelings of guilt and normalize the experience of survivor's guilt in bereavement. This question assesses the social worker's approach to grief and loss, specifically intense guilt. The keywords intense guilt, believing they are responsible, and consuming the client indicate that the client is experiencing a common but distressing aspect of grief. The best initial therapeutic response is to validate their feelings and normalize the experience, assuring them that such feelings are common in bereavement, rather than immediately challenging or reassuring, which can feel dismissive. For example, the social worker might say, "It's completely understandable to feel such intense guilt right now. Many people experiencing loss feel a similar sense of responsibility, even when it's not logical." This approach builds trust and helps the client feel understood before moving into deeper exploration or cognitive work. Question 9. A social worker is conducting a biopsychosocial assessment with a 15-year-old client who has recently been suspended from school for fighting. During the assessment, the client discloses that they have been consistently bullied by a group of peers and felt they had no other option but to physically defend themselves. What is the next most important area for the social worker to assess? A. The client's academic performance and future educational goals. B. The client's family history of aggression and violence. C. The school's bullying policies and support systems available to the client. D. The client's potential for self-harm or harm to others in response to the bullying. Answer: D. The client's potential for self-harm or harm to others in response to the bullying. This question highlights the importance of safety assessment, particularly with adolescents experiencing significant distress. The keywords suspended from school for fighting, consistently bullied, and felt they had no other option indicate high levels of distress and potential for both reactive aggression and internalizing struggles. After understanding the immediate context of the fight, the next most important area to assess is the client's current safety and risk of self-harm or further aggression, which always takes precedence in social work practice. For example, the social worker would directly ask about suicidal ideation, homicidal ideation, or specific plans, as well as coping mechanisms and support systems. This ensures the client's immediate well-being is addressed before moving to other aspects of their situation. Question 10. A social worker receives a referral for a 7-year-old child experiencing persistent nightmares, bedwetting, and withdrawal after witnessing a traumatic car accident. The child's parents are hesitant to discuss the accident with the child, believing it will only upset them more. What is the best approach for the social worker to recommend to the parents? A. Encourage the parents to avoid discussing the accident to prevent re-traumatization. B. Advise the parents to discuss the accident in a simple, age-appropriate, and supportive manner. C. Recommend that the parents seek family therapy focusing on communication skills. D. Suggest that the parents immediately enroll the child in a play therapy group. Answer: B. Advise the parents to discuss the accident in a simple, age-appropriate, and supportive manner. This question addresses trauma-informed care for children and parent psychoeducation. The keywords persistent nightmares, bedwetting, and withdrawal after witnessing a traumatic car accident indicate the child is exhibiting symptoms of trauma. While the parent's intention is to protect, avoidance often hinders processing. The best approach is to guide parents to gently and age-appropriately discuss the event, as this helps children make sense of what happened, reduces confusion, and provides an opportunity for emotional processing within a safe, supportive context. For instance, the social worker might help parents script how to say, "I know what happened was scary, and it's okay to feel sad or confused," allowing the child to ask questions and express feelings. This open communication promotes healing. Question 11. A social worker is working with an adolescent who is struggling with anxiety and social phobia. The client reports avoiding school dances and social gatherings, leading to increased isolation. The social worker and client have identified these avoidant behaviors as maintaining the anxiety. What is the most appropriate next intervention using a cognitive behavioral therapy, CBT, framework? A. Explore the adolescent's early childhood experiences to understand the origin of their anxiety. B. Teach relaxation techniques such as deep breathing and progressive muscle relaxation. C. Develop a hierarchy of feared social situations and begin gradual exposure. D. Encourage the client to journal about their anxious thoughts and feelings. Answer: C. Develop a hierarchy of feared social situations and begin gradual exposure. This question tests the application of cognitive behavioral therapy, CBT, principles for anxiety disorders. The keywords avoiding school dances and social gatherings, increased isolation, and avoidant behaviors as maintaining the anxiety strongly point to the need for behavioral intervention within a CBT framework. Gradual exposure, or exposure therapy, is a core CBT technique specifically designed to help clients confront feared situations in a systematic, controlled way, thereby reducing anxiety through habituation and disconfirmation of feared outcomes. For example, the social worker might help the client rank social situations from least to most anxiety-provoking, starting with something like making eye contact in the hallway, before moving on to attending a small social event. This directly targets the avoidance behaviors. Question 12. A social worker is facilitating a support group for survivors of domestic violence. During one session, a new member becomes visibly upset when another member describes a particularly violent incident, experiencing flashbacks and beginning to hyperventilate. What is the first action the social worker should take? A. Redirect the conversation to a less sensitive topic to de-escalate the situation. B. Excuse the distressed member from the group and provide individual support. C. Ask the other group members to offer words of comfort and support. D. Remind the group about the importance of using I statements when sharing. Answer B. Excuse the distressed member from the group and provide individual support. This question addresses crisis management within a group setting, specifically when a member experiences acute trauma symptoms. The keywords visibly upset, flashbacks, and beginning to hyperventilate indicate an immediate, acute crisis for that individual. The first action must be to ensure the safety and stabilize the distressed member by removing them from the triggering environment and providing direct, individualized support. For example, the social worker would calmly ask the member to step out of the group with them, offer a glass of water, guide them through grounding techniques, and assess their immediate needs. This protects both the individual in crisis and the rest of the group from further secondary trauma. Question 13. A social worker is providing services to an elderly client who lives alone and has multiple chronic health conditions. During a home visit, the social worker observes significant clutter, expired food in the refrigerator, and the client appears unkempt, though they deny any problems. The client also mentions having difficulty remembering to take their medications. What is the most important next step for the social worker? A. Document the observations and continue to monitor the client's living conditions. B. Educate the client on the importance of medication adherence and hygiene. C. Conduct a comprehensive assessment of the client's functional abilities and safety risks. D. Contact Adult Protective Services, APS, immediately to report potential self-neglect. Answer C. Conduct a comprehensive assessment of the client's functional abilities and safety risks. This question involves assessing an elderly client for self-neglect and safety concerns. The keywords significant clutter, expired food, unkempt, and difficulty remembering to take medications indicate potential self-neglect and safety risks for a client with multiple chronic health conditions. While these are concerning signs, the most important next step is to conduct a thorough and comprehensive assessment of the client's cognitive and functional abilities, social support, and specific safety risks, rather than immediately reporting or simply monitoring. For example, the social worker would use assessment tools to evaluate daily living activities, medication management capacity, and identify specific areas where support might be needed, all while respecting the client's autonomy as much as possible. This assessment guides appropriate, tailored interventions. Question 14. A social worker is working with a client who identifies as gender nonconforming and is experiencing significant distress due to family rejection and discrimination in their workplace. The client expresses feeling isolated and misunderstood. What is the best approach for the social worker to take? A. Focus on helping the client conform to societal expectations to reduce conflict. B. Encourage the client to cut ties with unsupportive family members and find a new job. C. Validate the client's identity and experiences, and help them build coping strategies and support systems. D. Provide the client with educational materials about gender identity and expression. Answer C. Validate the client's identity and experiences, and help them build coping strategies and support systems. This question centers on culturally competent and affirming practice with LGBTQ+ clients. The keywords gender nonconforming, significant distress due to family rejection and discrimination, and feeling isolated and misunderstood highlight the need for a supportive, affirming, and empowering approach. The best approach is to fully validate the client's identity and the reality of their struggles, then work collaboratively to build their resilience, coping skills, and connection to affirming support systems. For example, the social worker might explore the client's strengths, connect them to LGBTQ+ community resources, and help them develop strategies for navigating discriminatory situations, always centering their experience and autonomy. This fosters self-acceptance and provides practical tools for resilience. Question 15. A social worker is meeting with a 12-year-old child whose parents recently divorced. The child has been exhibiting increased irritability and withdrawal at home and school. During the session, the child states, "I wish my parents would just get back together, then everything would be normal again." What is the most appropriate response from the social worker? A. Explain to the child that their parents' divorce is not their fault. B. Validate the child's feelings and explore their understanding of the divorce. C. Advise the child to communicate their feelings to their parents directly. D. Redirect the child to focus on positive aspects of their current family situation. Answer B. Validate the child's feelings and explore their understanding of the divorce. This question tests the social worker's ability to communicate empathetically with children experiencing family changes. The keywords increased irritability and withdrawal and "I wish my parents would just get back together, then everything would be normal again" indicate the child is struggling with grief, longing, and potentially a lack of understanding about the permanence of the situation. The most appropriate response is to validate their feelings of sadness and desire for things to be different, then gently explore their understanding of the divorce, which helps the child feel heard and allows the social worker to correct any misconceptions. For example, the social worker might say, "It sounds like you really miss your parents being together, and it's totally understandable to wish things were different. Can you tell me more about what normal means to you now?" This creates a safe space for emotional processing. Question 16. A social worker is supervising a master's level intern who is struggling with managing boundaries with a client. The intern reports that the client frequently texts them outside of scheduled sessions, sometimes late at night, and the intern feels pressured to respond. What is the best action for the social worker supervisor to take first? A. Instruct the intern to block the client's number immediately. B. Co-sign a letter to the client explaining professional boundaries. C. Explore the intern's feelings about the client's texts and discuss professional boundary guidelines. D. Take over the client's case to ensure appropriate boundaries are maintained. Answer C. Explore the intern's feelings about the client's texts and discuss professional boundary guidelines. This question addresses ethical supervision and boundary management in social work practice. The keywords "struggling with managing boundaries," frequently texts them outside of scheduled sessions, and intern feels pressured to respond indicate a boundary violation that the intern is finding difficult to navigate. The best first action for a supervisor is to engage the intern in a collaborative discussion to understand their experience and then educate and guide them on professional boundary guidelines, empowering the intern to address the issue. For example, the supervisor might ask, "How do you feel when you receive these texts, and what do you think is the best way to handle them while upholding professional standards?" This fosters the intern's learning and skill development. Question 17. A social worker is conducting a risk assessment for a client who has a history of substance use disorder and recently relapsed after several years of sobriety. The client expresses intense shame and guilt, stating they feel like a failure and that their family would be better off without them. What is the most immediate concern for the social worker? A. The client's need for an intensive outpatient program. B. The potential for the client to experience an overdose. C. The client's risk of suicidal ideation and intent. D. The impact of the relapse on the client's family system. Answer: C. The client's risk of suicidal ideation and intent. This question prioritizes immediate safety in a complex scenario involving relapse and emotional distress. The keywords recently relapsed, intense shame and guilt, failure, and family would be better off without them are strong indicators of significant emotional distress and potential suicidal ideation, which is always the most immediate concern. While the other options are valid long-term considerations, assessing for suicide risk takes absolute precedence. For example, the social worker would directly ask about suicidal thoughts, plans, means, and intent, and then develop a safety plan if necessary, before addressing treatment modalities or family impact. Ensuring the client's physical safety is the foundational ethical imperative. Question 18. A social worker is providing psychotherapy to a client who discloses that they are having an affair with a married coworker. The client expresses immense guilt but also states they are deeply in love and do not want to end the relationship. The social worker maintains a non-judgmental stance but feels conflicted due to their personal values. What is the best course of action for the social worker? A. Advise the client to end the affair, citing the potential harm to others. B. Refer the client to another social worker due to personal value conflict. C. Continue to explore the client's feelings and the impact of their choices, seeking supervision to manage personal countertransference. D. Shift the focus of therapy to the client's childhood experiences to understand relationship patterns. Answer: C. Continue to explore the client's feelings and the impact of their choices, seeking supervision to manage personal countertransference. This question tests the social worker's ability to manage personal values and ethical principles, specifically countertransference and client self-determination. The keywords client discloses, having an affair, immense guilt but also, deeply in love, and social worker feels conflicted due to their personal values highlight the need for professional self-awareness and ethical practice. The best course of action is to maintain a non-judgmental stance, respect client autonomy by continuing to explore their experience and choices, and actively seek supervision to process and manage the social worker's personal values and potential countertransference. For instance, in supervision, the social worker would discuss how their personal views on fidelity are impacting their therapeutic objectivity and strategies for remaining client-centered. This ensures the client's needs remain central without imposing the social worker's beliefs. Question 19. A social worker receives a call from a client's landlord, who expresses concern that the client's apartment is excessively cluttered, has a strong odor, and they haven't seen the client in several days. The landlord states they are worried about the client's well-being. What is the first action the social worker should take? A. Advise the landlord that client confidentiality prevents the social worker from discussing the client. B. Attempt to contact the client directly by phone and through an unannounced home visit. C. Call emergency services, e.g., police or fire department, for a welfare check. D. Obtain a release of information from the client to speak with the landlord about their concerns. Answer: B. Attempt to contact the client directly by phone and through an unannounced home visit. This question focuses on addressing potential client safety concerns and upholding client self-determination. The keywords excessively cluttered, strong odor, and haven't seen the client in several days, coupled with the landlord's worried about the client's well-being, suggest potential self-neglect or an emergency. The first action is to attempt to contact the client directly to assess the situation and their safety, respecting their autonomy and privacy as much as possible before involving external parties. For example, the social worker would first try to call the client and, if unsuccessful, would conduct a welfare check at their home. If contact cannot be made or if immediate danger is confirmed, then further action, like involving emergency services, would be necessary. Question 20. A social worker is providing services to an adult client diagnosed with generalized anxiety disorder, GAD. The client frequently ruminates about minor worries, struggles with sleep, and often experiences muscle tension. They report that these symptoms have been persistent for over a year and significantly impact their daily functioning. What is the most appropriate initial therapeutic goal? A. Eliminate all sources of stress and worry in the client's life. B. Help the client identify the earliest traumatic experiences contributing to their anxiety. C. Teach the client mindfulness and relaxation techniques to manage anxiety symptoms. D. Encourage the client to apply for disability benefits due to the severity of their symptoms. Answer: C. Teach the client mindfulness and relaxation techniques to manage anxiety symptoms. This question tests knowledge of common interventions for generalized anxiety disorder, GAD. The keywords frequently ruminates, struggles with sleep, and muscle tension describe classic GAD symptoms that cause significant distress. The most appropriate initial therapeutic goal is to equip the client with practical skills to manage these pervasive symptoms, which often involves teaching mindfulness, deep breathing, or progressive muscle relaxation. For example, the social worker might guide the client through a guided meditation or a diaphragmatic breathing exercise during a session, then encourage regular practice at home. This provides immediate tools for symptom reduction, empowering the client to better regulate their physiological and cognitive responses to anxiety. Question 21. A social worker is working with a family where the parents express frustration with their teenage daughter's defiant behavior and poor academic performance. The daughter, in turn, states she feels ignored and that her parents only care about her grades. What is the best initial focus for the social worker in family therapy? A. Encourage the parents to implement stricter rules and consequences for their daughter. B. Facilitate communication between family members to express needs and feelings directly. C. Refer the daughter for individual therapy to address her defiance and academic issues. D. Educate the parents on typical adolescent development and rebellious phases. Answer: B. Facilitate communication between family members to express needs and feelings directly. This question addresses family dynamics and communication issues within family therapy. The keywords parents express frustration with, defiant behavior and poor academic performance, and daughter states she feels ignored and that her parents only care about her grades highlight a breakdown in communication and mutual understanding within the family. The best initial focus in family therapy is to improve communication, as this allows family members to express their perspectives, needs, and feelings more effectively, which is foundational to resolving conflicts and improving relationships. For instance, the social worker might use active listening exercises or I statements to help the parents and daughter articulate their concerns without blame. This helps bridge the gap between their perceptions and fosters empathy. Question 22. A social worker is working with a client who reports experiencing auditory hallucinations, hearing voices, and paranoid delusions, believing they are being watched by the government. The client appears agitated and is having difficulty maintaining coherent thought. The client has a known diagnosis of schizophrenia but has recently stopped taking their prescribed antipsychotic medication. What is the most appropriate next action for the social worker? A. Explore the client's reasons for discontinuing their medication. B. Immediately call emergency services for an involuntary hospitalization. C. Educate the client about the importance of medication adherence. D. Focus on reality testing by challenging the client's delusions directly. Answer: A. Explore the client's reasons for discontinuing their medication. This question assesses the social worker's response to a client experiencing acute psychiatric symptoms due to medication non-adherence. The keywords auditory hallucinations, paranoid delusions, agitated, difficulty maintaining coherent thought, and recently stopped taking their prescribed antipsychotic medication indicate a clear exacerbation of symptoms linked to medication. Before any other intervention, the most appropriate and collaborative next action is to understand the client's perspective and reasons for stopping medication, which is essential for engaging them in a solution. For example, the social worker would non-judgmentally ask, "Can you tell me what led to you stopping your medication?" This approach prioritizes rapport and client understanding, which are crucial for re-engagement in treatment. If immediate danger were present, hospitalization would be considered, but understanding the client's decision is usually the first step when safety allows. Question 23. A social worker is asked by a client to write an emotional support animal (ESA) letter, but the social worker has not conducted a comprehensive assessment of the client's need for an ESA and does not have specific expertise in animal-assisted interventions. What is the best ethical response from the social worker? A. Decline to write the letter, explaining the lack of expertise and assessment. B. Write the letter as requested to support the client's perceived needs. C. Refer the client to another professional who specializes in ESA assessments. D. Conduct a brief assessment and then write the letter based on the client's request. Answer: A. Decline to write the letter, explaining the lack of expertise and assessment. This question tests the ethical principle of competence and professional boundaries in social work practice. The keywords "has not conducted a comprehensive assessment" and "does not have specific expertise" clearly indicate that the social worker lacks the necessary information and qualification to ethically fulfill the client's request. The best ethical response is to decline the request while transparently explaining the reasons, as practicing outside one's scope of competence can harm the client and is unethical. For example, the social worker might say, "I understand you're looking for an ESA letter, but for me to ethically write one, I would need to complete a thorough assessment, and this isn't an area of my specialized practice." While referral is often a next step, the immediate best response to the direct request is to decline based on competence. Question 24. A social worker receives an urgent phone call from the parent of a 10-year-old client, stating that the child has threatened to run away from home after an argument about their phone. The parent sounds distressed and asks for immediate advice on how to handle the situation. What is the first response the social worker should offer? A. Advise the parent to take the phone away permanently as a consequence. B. Instruct the parent to call the police immediately to report a runaway threat. C. Coach the parent on how to de-escalate the situation and ensure the child's immediate safety. D. Schedule an emergency family session to mediate the conflict. Answer: C. Coach the parent on how to de-escalate the situation and ensure the child's immediate safety. This question focuses on crisis intervention and ensuring client safety, particularly for a child. The keywords urgent phone call, 10-year-old client, threatened to run away, and parent sounds distressed highlight an immediate family crisis with a potential safety risk to the child. The first response should be to guide the parent in de-escalating the immediate situation and securing the child's safety, as this is paramount. For instance, The social worker might suggest the parent remain calm, validate the child's feelings, offer to talk, and ensure the child is not alone or in a position to leave. This immediate, practical guidance helps prevent the threat from escalating into an actual runaway situation. Question 25. A social worker is meeting with a 65-year-old client who has recently retired and expresses feelings of purposelessness, isolation, and a sense of declining physical and mental abilities. The client states, "I just don't feel like I have much to contribute anymore." Which stage of Erikson's psychosocial development is the client most likely struggling with? A. Identity versus role confusion. B. Intimacy versus isolation. C. Generativity versus stagnation. D. Ego integrity versus despair. Answer D. Ego integrity versus despair. This question tests knowledge of Erikson's stages of psychosocial development, specifically related to later adulthood. The keywords 65-year-old client, recently retired, purposelessness, isolation, declining physical and mental abilities, and don't feel like I have much to contribute anymore are all classic indicators of the crisis associated with ego integrity versus despair. This final stage involves reflecting on one's life, feeling a sense of fulfillment and wisdom, integrity, or experiencing regret and bitterness, despair, about missed opportunities. For example, a social worker might help the client explore past accomplishments and current opportunities for engagement to foster a sense of purpose and contribution. Understanding this stage helps social workers tailor interventions to support clients in finding meaning in their later years.